It is 1958. You are pregnant. You are exhausted. The morning sickness is relentless. Your doctor hands you a small white pill and tells you it is completely safe, safer than aspirin. Tested. Approved. Thousands of women are already taking it. You take it home. You take it that night. And somewhere in the next 8 weeks, without knowing it, without feeling anything wrong, you have just changed your child's life forever. The pill was called thalidomide. In Germany it was sold as Contergan. It was marketed in 46 countries as a mild sedative, safe, gentle, non-toxic, perfect for pregnant women struggling with morning sickness and sleepiness. The company that made it called it one of the safest drugs ever developed. Between 1957 and 1962, more than 10,000 babies were born with severe physical deformities. Thousands more were miscarried. And the women who caused it had done absolutely nothing wrong. I think about this as a mother. I think about what I would have done. Lying awake at 2 in the morning, nauseous, exhausted, unable to sleep. My doctor, someone I trusted, completely handing me something and telling me it was safe. I would have taken it. Every single one of us would have taken it. That is the part of this story that I cannot shake. These were not careless women. They were careful, trusting, doing exactly what they were told to do. And they were betrayed by the people they trusted most. Thalidomide was first developed in 1953 by a Swiss company. They abandoned it. A German pharmaceutical company called Chemie acquired it and began testing. The tests were limited. The drug was never properly tested on pregnant animals, but it produced no immediate toxic effects in adults. It didn't kill rats at high doses, and that was considered sufficient evidence of safety. In October 1957, it went on sale in West Germany without a prescription. Within 2 years, it was the second best-selling medication in the country, after aspirin. The marketing was aggressive and deliberately reassuring. One advertisement in the UK stated, and I want you to hear these exact words, that the drug could be given with complete safety to pregnant women and nursing mothers without adverse effect on mother or child. They printed that. They knew it had never been tested on pregnant women. They printed it anyway. Because sales mattered more than the question they had not yet bothered to answer. By the late 1950s, something was happening in maternity wards across Europe that had never been seen before in such numbers. Babies were being born with phocomelia, a condition where the limbs do not develop properly, leaving hands and feet attached directly to the torso, or missing entirely. Doctors expected to see occasional birth defects. They did not expect to see this ward after ward, country after country, the same pattern appearing in babies whose mothers had otherwise healthy pregnancies. The drug had a specific and terrifying window of damage. If a pregnant woman took thalidomide between the 20th and 37th day after conception, often before she even knew she was pregnant, the drug interfered with the development of the fetus's limbs, eyes, ears, and brain. A single dose on the wrong day was sufficient. The women who took it after that window delivered healthy babies. The ones who took it during those critical days did not. And because the window was so precise, many doctors initially could not understand why some women who took the drug were affected and others were not. The warnings came. A German doctor named Ken Lenz began noticing the pattern in 1961. He contacted Grain-Ethel directly and told them he believed their drug was causing the birth defects. The company's response was to pressure him to stay quiet and to dispute his findings. An Australian doctor named William McBride independently reached the same conclusion and managed to get his hospital to stop prescribing the drug to pregnant women. He wrote to the Lancet. He was largely ignored. The drug remained on the market. Now here is the part of this story that most people never hear. The United States was almost untouched by the thalidomide disaster. Not because American regulators were smarter. Because one woman said no. Her name was Frances Oldham Kelsey. She was a pharmacologist at the FDA, the Food and Drug Administration, and in 1960, the American distributor of thalidomide submitted an application for approval to sell the drug in the United States. Frances Kelsey reviewed the application and found it insufficient. The safety data was incomplete. The drug had not been adequately tested. She sent the application back and asked for more evidence. The pharmaceutical company pressured her. They complained to her superiors. They called her an obstacle and a bureaucrat. She reviewed the resubmitted application and sent it back again. And again. For 14 months, she held the line one woman, in one office, repeatedly saying that the evidence was not good enough while the same drug was destroying thousands of babies across Europe. In November 1961, the European connection to birth defects was finally confirmed and thalidomide was pulled from the market. In the United States, thanks entirely to Frances Kelsey's refusal to approve insufficient evidence, the disaster was almost entirely avoided. In 1962, President Kennedy awarded her the President's Award for Distinguished Federal Civilian Service, one of the highest honors available to a civilian. She had saved an unknown number of American children from the fate that had befallen thousands of children in Europe. By doing nothing more dramatic than her job, I think about the mothers who found out, who delivered their babies and understood, in that moment, what the small white pill had done. Who had to carry that knowledge, that they had done this, even though they had done nothing wrong, even though they had trusted the people they were supposed to trust. I cannot imagine that weight. I think about it as a mother and I cannot find the bottom of it. The thalidomide disaster directly created the drug approval system that protects every pregnant woman today. Before 1962, pharmaceutical companies in the United States did not have to prove their drugs were safe and effective before selling them. After thalidomide, the Kefauver-Harris amendments required extensive animal testing, clinical trials, and proof of both safety and effectiveness before any drug could reach the market. Every drug your doctor prescribes today, every medication considered safe in pregnancy, exists within a regulatory framework built on the wreckage of what happened to those 10,000 families. The thalidomide survivors, the children who were born with the deformities and survived, are in their 60s now. Many have spent decades fighting for compensation from Grunenthal, the company that made the drug. In 2012, 50 years after the disaster, the company issued a public apology. It was the first time they had done so. The survivors noted that the apology came without the company representative looking directly at them. They noticed that detail. After 50 years, they still noticed. Today, when a pregnant woman is prescribed anything, when a doctor says this is safe in pregnancy, that safety claim rests on decades of testing that did not exist in 1957. The question that Frances Kelsey kept asking, where is the evidence, is now built into every drug approval process in the developed world. We do not think about where that question came from. We do not think about the 10,000 families who paid for the answer. But every safe pregnancy today carries, somewhere in its background, the shadow of the ones that were not. I started this channel because I wanted to understand what women before us knew, the habits, the wisdom, the systems that kept households and families and pregnancies running. But the thalidomide story is the other side of that. It is the story of what happens when the systems fail. When the people trusted to protect pregnant women choose sales over safety. When one woman in an office says no and holds the line while everyone around her says yes. Frances Kelsey never became famous the way she should have. The mothers who were harmed never got the apology they deserved in time, but we are here. And we know their names now. I want to be clear about why I'm telling this story. This is history, not a warning about medicine today. The entire reason drug testing exists now, the entire reason your doctor can tell you something is safe in pregnancy and mean it, is because of what happened here and the regulations that followed. If you are pregnant and worried right now, please don't be. Talk to your doctor, trust the process, and know that the system protecting you exists precisely because of this story. If this is the kind of story you want to keep hearing, subscribe before you go.